Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
So I have a question regarding neck strengthening. So I've been receiving my neck treatments for the past 2 months, and I feel that I am 95% recovered in terms of symptoms and things that I can do. Like I can do pretty much, I'm back to my previous life, back to factory settings to some extent. However, I do feel some headache every day. Not much, I would say on a pain scale would be 1 or 2, but it's there, the sensation's there, as well as the joint restriction in my neck. That's there as well. Like when I get my neck adjusted or get treated, it goes away for, I would say, a day or two, and then it comes back. However, one of my question was, given that I have some daily head pain, how can I determine when it's good to begin strengthening my neck? Do I have to be completely pain-free to start, strengthening my neck? Because even if I wear my iron neck, I can feel the pain in my forehead and other parts.
Yeah. The treatment you're getting, are they doing soft tissue work as well?
So I go to a physio and a chiropractor. They dig into my neck. They do mobility one, and the chiropractor helps with some massage in my neck as well as the adjustment. Yeah. I should ask them if it's soft tissue, but they dig into my neck and press stuff and try to create that pain in my head.
And are they able to?
Not all the time. It's just one time recently where my physio pressed down on my SCM, I guess, and there was a pain radiating onto behind my eyes.
Yep.
But not all the time. Every time I do these sessions, I feel better.
Good.
Rather than in pain.
Right. Good. So I think they're on the right track. They may just not be digging in hard enough. Like usually when I'm treating somebody, they're like screaming like as I do it, because it's like I'm causing their headache pain as I'm doing it. Right. So if they're not doing that, they may just be, because some people are cautious. They don't want to cause pain to the patient. So they really kind of like just take it easy. And that will still work, but it does take a lot longer. Right. Like I tend to err on the side of like, I'm going to just get in there and like work this out, because the faster or the deeper I can get, the better it's going to be, the faster it's going to be. But that comes with a trade-off sometimes, because it really flares people up. And so they have to kind of work around that. But the way that so again, I'm going to share my screen again. This is getting into the next kind of iteration of the Concussion Fix program. But this is the way that I kind of look at it. So this dotted line here, you can see this? Everyone can see this? This dotted line here is kind of like your headache and dizziness, right? Now, at the start, when your headache and dizziness scores are high, you want to be basically all manual therapy. Now, as that starts to come down, you don't have to be all the way back, but then the next step is to start in with proprioceptive rehab. So like range of motion exercises, kind of the laser headlamps, like getting to know where your head is in space, right? Walking with head turns, maybe a little slow VOR type stuff where you're moving back and forth like this. All of this stuff just improves like your body's awareness of where your head and neck are in space. And then shortly thereafter, you start that. Now you want to start ramping up strengthening, right? And you want to kind of decrease the frequency of manual therapy along the way. So it's kind of this crossover effect that starts to happen. So you don't have to be completely symptom free before you start doing these types of things. But generally the order is manual therapy, then proprioceptive exercises as the pain has come down pretty substantially. Let's say when you have about a 60 to 70% drop in the pain or the dizziness, now it's time to start ramping up with the proprioception and then integrating after that into the strengthening side of things. Because what happens is, like, you're noticing that you feel good for like a day or two, and then it starts to come back again. So sometimes that just indicates that there's just some weakness there. And by strengthening it, you'll start to get more longevity out of the treatments, meaning that it'll last longer and longer, because the weakness often is what comes back into the dysfunction and then causes the symptoms to kind of creep back up again, right? It could also be that they're just not getting to the root cause, right? So on the manual therapy side, maybe they're not getting deep enough, maybe they're not getting to the right tissues, so on and so on. So it could be a combination. So you may ask them like, "Hey, can you dig in and like cause my headache as you're treating me? Because that's really what's going to kind of move the needle and help it to go away." But then also it's start integrating proprioception and strengthening, kind of in a bit of tandem. Um, and yeah, so then that'll give you the strength you need so that the symptoms don't keep coming back so frequently. Do you know what I mean?
Gotcha. Okay. No,
Yeah.
sounds good. I'll have a chat with them. Just another just one follow up I have, just in terms of my joint restriction. Earlier, whenever I did get adjusted, it used to come back within an hour, and now it's 2 days. So I guess there's some progress.
Yep.
So my question is, I'm considering traveling for a month during which I won't have access to my treatment. Would
Yep.
this set back my progress, especially since my neck has not fully resolved yet? Is there anything I can do to maintain my progress?
I mean, obviously it if there's an issue there and it's not being addressed, yeah, things can come back. But if you've gotten to a point now where you're, 90% of the way there, I don't think you're going back to 0, right? And I think just understanding that it's just a neck issue, like, kinda gives you a little bit of confidence to say, like, "Oh, yeah, my neck is just, flaring up again," and you don't start worrying that your brain or is permanent or anything like that. But if you I don't know when you're leaving, but if you could get on some you know, getting maybe they can give you some self-massage type techniques based on your particular issue that you can do while you're away, giving you a little bit of kind of stretches and stuff you can do while you're traveling to just kind of help stave off, a dramatic decline. I think that would be good.
Okay, that sounds good.
Yeah.
Uh,
I mean, it's part of it, right? Like if you have to travel, then, you're not gonna have access to things and things can creep up. But sometimes depending on what you're doing, travel can actually get rid of everything because you're in a relaxing environment, I don't know. I don't know where you're going or what you're doing, but if it's a nice vacation or something, sometimes that can just help to just really calm things down and give your neck the break it needs to just kind of reset. So sometimes it can be very beneficial. So it's hard to say.
I was just gonna say that. I was like, sometimes vacation just takes away that day-to-day stress that we have at home. If you have a seated job, sometimes people aren't sitting anymore when they're on vacation, so they're moving their bodies more, they're feeling more relaxed, and that can actually just, create less issues than you might have when you're home. And I can almost hear Dr. Herkel suggesting some of the like muscle supportive supplements like magnesium. Of course, he's not here, but if that's something that's appealing to you, you could always send him a direct message, say, hey, I'm going to be traveling. What kind of supplements can I bring with me?
Mm.
That might help sort of relax muscles while I'm gone and get you through so you can enjoy your vacation.
for sure.
I was talking to somebody recently. I can't remember if it was on one of these lives or if it was an in-person thing, but they were saying that they were kind of like 80% of the way there, and then they had this trip to Thailand, and they were in Thailand for a month, and they got to 100% just because they weren't thinking about their symptoms. They were out traveling, out and about, and they would go through a whole day and be like, "Oh, I don't think I had any symptoms today," because it just takes your mind off of it and just puts you in a different environment or whatever. And so that last 20% came from just traveling and getting outside their usual routine and focusing on other things. And yeah, so I mean, there's something to that.
Yeah, we tend to be a lot more present on vacation as well. And when we're present, we're not worrying about the past or sorry, we're not thinking about the past or worrying about the future. And that kind of just allows us to be fully present. It's almost like a built in mindfulness practice sometimes when we're on vacation because we're just living in the moment. And when we live in the moment, our mind doesn't tend to be as busy about all the things that could go wrong and worrying about the things that have happened in the past and predicting the future and thinking, oh my gosh, what's coming next. It's just kind of allows us to have a break from all that. So there's a lot of kind of subtleties and built in lessons on vacation as well. When it comes to concussion recovery.
Oh, amazing. No, thank you. I was gonna go meet my family, so that's added on stress. as it is. But for sure. Thank you.
Yeah, that might be an exception, but
Yeah, good luck.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.